Hello class, my name is Jessica Hollen and I am a 13-year registered nurse. I have been an ICU nurse, mainly in the surgical trauma area. For the last 3 years, I have been a travel nurse with Geisinger, and this is my slideshow and lecture on community assessment. I have chosen to do my project. As you can see here, there's a nice little map of Pennsylvania. My county of choice is Cambria County, which is highlighted there in red at the top. And I have chosen more specifically Ashville Borough, which you can see the blue dot in the middle of Cambria County there. Cambria County is located in southwest Pennsylvania. It is considered an energy county because of its production of electricity through the use of natural resources, mainly in power plants throughout this county. There are 63 municipalities, 32 boroughs, and 30 townships, and there are approximately 132,728 residents based on the 2011 census. I have chosen to do my project within the state of Pennsylvania. If you can see here at the top of this slide, the little red area is Cambria County, and more specifically, at the left lower area of the slide, the blue dot is Ashville Borough. Cambria County is located in southwest Pennsylvania. It is considered an energy county because of its production of electricity through the use of natural resources in power plants. There are 63 municipalities, 32 boroughs, and 30 townships. There are approximately 135,871 residents. For comparison against Cambria County, I've chosen to use Blair County, which, if you're looking at the top of the slide and you locate the red area, which again is Cambria County, Blair County is slightly to the right of Cambria County, or east. I have chosen to do my windshield survey on the town of Asheville, or also called Asheville Borough. It is a rural area located in northeastern Cambria County, and as you can see here on my slide, I've taken a picture of housing, small town store, the fire company, and a church. The main route through town is Route 36, and it runs east to west. There are about 100 houses in town, and most of them seem to be older two-story houses. I would say 2 out of about every 5 houses seem to be unkept. Some are in need of repair and for sale. Other homes seem unkept with some moderate upkeep. I would say that there are that the property value in this area seems low. There are small yards with no real landscaping. The town does have a nice park behind the Asheville Volunteer Fire Company. The park seems to utilize its space well, and it consists of swings, slides, merry-go-round, baseball fields, and a walking track around that field. I would like to note that there is a wheelchair swing within the park, which makes me believe there is a child within the community that would benefit from this addition. At the time whenever I did my windshield survey, the park seemed empty, but I do want to note that the temperature outside was 30 degrees and it was winter. There seems to be quality use of this open space. Some hangouts that I noted for the town are 5 main places. First, Captain Ron's Deli, which is a food and mini mart, open from 6 a.m. to 9 p.m. daily. It's a single-story building which seems to be well kept with metal roofing and siding. There are gas pumps out front, but they are down for maintenance, so no gas is available within the town of Asheville. When I entered, there seemed to be about 5 middle-aged men and women hanging out, drinking coffee, purchasing items, and playing the lottery. The second hangout I would note is the VFW, which is Veterans of Foreign War, and it is a bar that serves some food and alcohol. They are currently not open during my windshield survey, but their hours are on the door and it says from 3 to 10 daily. Residents say this is the hangout in town, but you need a membership to enter the VFW, or you need to know somebody in order to sign you in. This is the only bar in town. Third is the park that I spoke of earlier, which consists of the swings, slides, and merry-go-round, baseball fields, and the walking track. And this I would believe to be a summer hangout for children and families. The fourth place or hangout is St. Thomas Aquinas Church, which is the only church in town. And it's a way for the Catholic community to come together. Fifth is Clapper's Barber Shop, which is a little building. It's open Tuesday through Friday, 10 a.m. to 7 p.m., with hours on Saturday as well. It's a single-story block building, which is painted all white, located right where Route 36 connects with Route 53. When entering this building, the barber is an older white man who has 2 older white men hanging out at the counter talking. Other businesses in town are Woody Lodge Winery, Cool's Auto Repair, All-Star Auto Repair, A Fine Furniture Resale, Panitti's Flooring, Gibson Funeral Home, Weekland's Wheel Horse Warehouse. I would like to say Ashville Inn and Segrist were both bars in town, and they have been closed and the buildings are up for sale. There are 27 schools, 6 colleges in Cambria County. I did note some violence and safety articles about Cambria County, and we'll go over those statistics later on throughout this slideshow. Religion, as I mentioned, there's only one church in Asheville. It's a Catholic church, and it's called St. Thomas Aquinas Church. The area does seem very limited, with only one Catholic church in town. 46% of Cambria County residents are Catholic, with 11% being Methodist. Ethnicity, everyone cited around the town in Asheville in the deli and at the barber shop were all white. This leads me to believe that most of the town residents are of white ethnicity. Economy, only 3 main businesses in town, as I mentioned with the hangout. There's Captain Ron's, which is the deli, the VFW bar, and then the barber shop. And I would also consider the parks a hangout as well. There's no gas sold in town right now due to the pumps being under maintenance. I believe the economy to be dilapidated, with residents used to going outside of the town for their needs, such as gas or groceries or the doctor's office. For government, the borough of Asheville is located in Asheville, Pennsylvania. This organization primarily operates in the city and town manager's office. This is mostly in the legislative and general government. This organization has been operating for approximately 132 years as the Borough of Asheville. They employ 7 people. The mayor is currently Dana Harold, and most of the people in Asheville are Democratic. There were 92,456 registered voters in Cambria County. Our main issues, as we'll go over throughout this slideshow, tend to be cardiac health, obesity, smoking, alcohol. As we know, obesity and smoking lead to additional comorbidities such as hypertension and diabetes and cancer. I do not see a gym in this town. The closest gym and hospitals and other doctors' offices seem to be in nearby towns such as Crescent and Altoona, which are anywhere from 8 to 10 miles away. UPMC Altoona, MedExpress, and chiropractors are mostly found in Altoona, about 10 miles away. There are 11 total hospitals in Cambria County, 23 private care providers, 14 home health agencies, 5 long-term care facilities, 29 emergency services, 37 dentists, 5 dialysis clinics, 9 rehab services, 4 behavioral health services, 7 cardiology services, 4 orthopedic services, 3 OBGYN clinics, and 34 social services. The PA Department of Health is located in Johnstown, PA, for the Cambria County residents. Signs of decay, I would have to say there are no noticeable abandoned cars or garbage laying around. I do see garbage bins and dumpsters being used. It looks like a few houses are condemned and need to be rehabbed or torn down. For lifestyle, the people seen within the store and the barber shop look to be obese with some smoking. And as I went over earlier, smoking and obesity lead to other comorbidities. Alcohol abuse is a concern which affects our liver. Food served at the deli in the VFW mainly consists of all fried foods, so healthy nutrition is an issue. The deli did have some salads on their menu, but no fish or seemingly healthy options. So I believe the community of Asheville has a median age around 47 years old. There are more widowed women due to the fact that women live longer than men. It is of moderately low economic status, considering 2 out of every 5 houses appear to be run down and in need of repair. There are no medical facilities in town, making residents travel around 10 miles for care or medications. There are only 3 small businesses in town with no gas sale. Residents may be doing business outside of the town, considering they already have to reroute frequently for gas or other items not sold in town. There's no gym. Obesity is an issue, which increases risks for hypertension and diabetes. Smoking and alcohol are addiction and coping mechanisms and seem to be used in this area. Working out is a coping mechanism used a lot by people, and I think the lack of a gym in this area could contribute to not only obesity, but the increased alcohol consumption and smoking. Based on this windshield survey, this small community consists of about 100 houses with residents that seem to be mainly all white ethnicity. Population. Now, for comparison purposes, I did choose to compare Cambria County to its neighboring county, Blair County. The state population is 12.8 million. Per the 2018 U.S. Census, Cambria County's population is 135,871, which is slightly larger than Blair County's population of 124,796. Median age. As we can see here, Asheville's median age is slightly higher than the states and counties. Right now, Asheville's median age is about 45, while Cambria County's is 45, and Blair County's is only 43.1, and the state's is only 40.8. As I stated in my windshield survey, mostly the residents appeared to be white. This, based off of the census, is correct, even when comparison with the town, the county, and the state. It looks to be like Asheville has 93.5% residents that are white or non-Hispanic or Latino, while Cambria County has 76.1 and Pennsylvania has 92.7. Household income. Household income I have compared with the town, Blair County, Cambria County, and the state of PA. Unfortunately, Asheville appears to have the lowest out of the for comparison. Asheville's lowest household income with $43,393. Blair County's household income is $45,664. Cambria County's household income is $44,943, while Pennsylvania's household income is $60,905. The percentages of houses owned are higher in Asheville when compared to county and state. Asheville has a percentage of 91.5, while Cambria has a percentage of 74, and Pennsylvania a percentage of 69%. Property value. Property value, it looks to be that Asheville is in between on this comparison. The state has the highest property values at $186,000, with Asheville next up at $135,200. Then Blair County at $117,300, and Cambria County at $88,900. Monthly home expense is broken down into three categories, our first being medium gross rent. Pennsylvania has the top at $915 a month, with Asheville following at $633 a month, and Cambria County at $620 a month. Next comparison is median without mortgage. PA again is top at $531 a month, with Asheville next at $441 and Cambria County at $440. Last comparison is median with a mortgage. PA is leading again at $1,474 a month, with Asheville at $1,335 and Cambria County at $1,027. Monthly home expense is broken down into three categories. First being medium gross rent. PA is leading at $915 a month, with Asheville at $633 and Cambria County at $620 a month. Next comparison is median without a mortgage. First is $531 a month, which is PA. Second is $441 a month, which is Asheville. And last is Cambria County at $440 a month. Last comparison is median with a mortgage. First is PA at $1,474 a month. Next is Asheville at $1,335 a month. And Cambria last at $1,027 per month. This slide shows our poverty levels with 4 comparisons, and the highest being Asheville at 17.9%, with Cambria County following at 15.6%. Next is Blair County at 15.2%. Lastly, PA at 13.1%. Here are 2 comparisons on this slide. One is language, next is persons per household. It's interesting here, language, that in the state of PA, there are 11.3% of people that speak other languages other than English. But mostly in Cambria County, only 2.8 speak languages other than English, while in Asheville, only 2.6 speak languages other than English. So most definitely there is not other languages spoken in the town of Asheville other than English. There are mainly around 2 people per households in all comparisons. Here we're looking at Pennsylvania has 2.5 persons per household, while Cambria County has 2.2 and Asheville has 2.3. Education with comparisons in high school degree or higher. Cambria County leads at 91.3%, with PA following at 90.2%, and Asheville being the lowest at 87.5%. Next education comparison is a bachelor's degree or higher. The leading is the PA percentage of 30.8, followed by the Asheville percentage of 24.7. Then the Cambria County percentage at 21.4. Health is next with comparisons in disability and no health insurance. Disability less than 65 years old. First is Cambria County at 13.2%, followed by Asheville at 13.1%. Lastly, at PA with 9.8%. Our next comparison is no health insurance. First is Cambria County at 13.2%, followed by PA at 6.7%. Lastly, Asheville at 4.0%. Death rates are next with comparisons per 100,000. Our leading is heart disease, and Cambria County is higher than PA at 190.2 compared to 176.3. Cancer is next, which is 166.7. Cambria County with the state at 165.9. Next would be MVA, motor vehicle accident. Higher at Cambria County at 87.9 when compared to PA at 54.5. Next is stroke. In Cambria County is 37.4 when compared to PA at only 37. Lastly are communicable diseases such as HIV, AIDS, TB, or STDs. They are, again, higher in Cambria County at 17 than NPA at 14.8. After reviewing the death rates, we are able to see our first problem is heart disease. Again, Cambria County is at an alarming 190.2 per 100,000 people when compared to 176.3 in PA. That is an alarming distance in numbers. quite a jump for a county. And that brings me to my health promotion project, which I did at the Carrolltown Senior Center. I did 18 manual blood pressure screenings. I assisted 4 weight measurements on a level beam scale that was already at the area of aging facility. I provided each person with a flyer from the American Heart Association on how to monitor their cardiovascular health. I developed this educational bulletin board, as you can see here, which mainly contained information from the American Heart Association. Here are the results from my health promotion project. 22.2 had normal blood pressures, meaning less than 120/80. 66.7 had elevated blood pressures, 120 to 129/80. 11.1 had high blood pressure stage 1, meaning 130/80 to 139/89. 5.6% had high blood pressure stage 2, meaning 140/90 to 179/119. I am happy to report none of the patients had been in a hypertensive crisis, meaning greater than 180/120. All the participants were alert and oriented, denied any chest pain and shortness of breath, and those with an elevated and high blood pressure were educated, and they agreed to make or already had a doctor's appointment within the next 5 days. I also did education on diet, such as decrease in sodium intake, and exercises to help with cardiac monitoring and health. Problem number 2, which all of these 3 tend to go hand in hand, are overweight, obesity, and physical activity. Now, I listed these in comparison to Cambria County and state, but what I noted here was that Cambria County beat the state with the overweight percentage, with Cambria County at 4.3% and the state at 2.5%. Now, the state did beat Cambria County with the obesity rate at 4.4%, with Cambria County at 2.4%. And it looks like they're head-to-head with percentages when it comes to physical activity, both being at 2%. Problem number 3, diabetes. Diabetes is an issue throughout the nation. Here, diabetes is higher in Cambria County at 13%, which is in comparison to PA at 11%. Problem number 4, drug and substance abuse. Much higher in Cambria County at 46 when compared to PA at 35.1. Problem number 5, suicide. As we can see here, Cambria County again is much higher at 18.9 when compared to PA at 13.4. Now, this is suicide per 100,000 from 2012 to 2016. Problem number 6 is Lyme disease. As you can see here, it has higher percentage at 13.4 in Cambria County compared to 8.5 in PA. Problem number 7 is smoking. As you can see here, 21% in Cambria County compared to 18% in PA. And problem number 8, COPD, which goes hand in hand with smoking, at 18.7 in Cambria County and 17.6 in PA. Problem number 9 is safety. I came across this study in Cambria County that compared the feeling of safety as well as being attacked within the county in comparison to the state. Safety percentage here for Cambria County, 19.7% reported feeling safe, while 20.5% throughout the state reported feeling safe. Attacked, 1.4% reported being attacked in Cambria County, while only 1.2% reported being attacked in the state of Pennsylvania. Last but not least is problem number 10, our limited transportation. I noticed that there were no bus stops within the town of Ashville, and the closest taxi is in Altoona, Pennsylvania, which is about 13 miles away. This day and age, you do have access to Uber through your phone, but that is limited as well. My key informant interview was with Diana Harmon. She is the director of the nutrition group. I had the pleasure of meeting her whenever I did my health promotions project with the seniors. She voiced three main concerns, the first one being in dietary or nutrition education. An example she gave me is when the seniors are offered a choice of sugar-free cookie or a cookie with sugar in it, they go for 3, 4, or even 5 of the sugar-free cookies, telling us it's better than one of the sugar cookies. She believes there is a knowledge gap there and a need for education on moderation in nutrition. The second concern she voiced to me are the lack of personal care when some of the seniors approach for their meals. She just wants them to know through education that if there is a need to help with their activities of daily living, that the goal of the senior center is to keep them in their home and independent as long as possible. The third concern she voiced to me is that the seniors tell her when they go to the doctor's office and ask for something and don't receive it, they then go to a different doctor and ask for the same medication, and they will doctor hop until they receive what they want. This, of course, raises our eyebrows in the healthcare field because it creates multiple polypharmacy discrepancies. Vulnerable populations. In public health, the community is the population, and as nurses, we are to help care for this vulnerable population. They include people who are racial or ethnic minorities, such as children, the elderly, socially, economically disadvantaged, underinsured, or those with certain medical conditions. Throughout this course, I've had the pleasure of working with two groups that are considered vulnerable. My first group was the elderly when I did my health promotions project at the Area for Aging Senior Center. I did the blood pressure screenings and some teaching on cardiovascular health. Statistically, the majority of older adults require continual health care for at least one or more chronic conditions, such as obesity, cardiovascular disease, diabetes, stroke, or cancer. The second group I got to work with, or planning to work with, was to do my clinical rotation with the school nurse. I chose Cambria Heights High School, which is a public school within the Cambria County, which consists of about 1,341 students. They do have a minority enrollment, about 2%, and 38% of the students receive free or reduced lunches. Diseases that are a factor in children are usually communicable diseases as well as obesity. I came across a research article called School Environments and Obesity. This article explored the association between high school age students, ages 11 to 17, their personal stress, and obesity. Interesting enough, the high school students' environment, which sometimes includes bullying, physical safety, and lack of whole school connectedness, All of this was associated with an increased likelihood of being overweight among the females, interestingly, though not the males. This study believes that males were found more likely to exercise, therefore help them cope more effectively. Healthy food was found in 87.9% of the schools conducted in this study. Now, they did go over some limitations of this study, such as the height and weight were self-reported, and just the overall goal of this study was to improve the environment and decrease childhood obesity. We must remember our older adults and children in our community, and I wanted to thank everybody for taking the time to listen to this. You probably all know more than what you ever wanted to know about Cambria County and Ashville Borough. Again, thank you very much and have a good day. Here are my list of references that I used throughout my lecture and slideshow. Again, thank you all and have a good day.